Have you ever wondered what happens when your heart valves don't work as they should? Imagine a bustling city with roads, highways, and traffic signals. Now envision those traffic signals failing to function correctly. Chaos, right? That's essentially what happens in our bodies with heart valve disease. Our hearts, the tireless workhorses, pump blood throughout our bodies thanks to 4 valves. These valves ensure that blood flows in the right direction. But what if they malfunction? This is where heart valve disease enters the picture. It's a condition where one or more heart valves don't open or close properly, disrupting the blood flow. Understanding heart valve disease is crucial because it's more common than you might think. Millions of people worldwide are affected by it. Moreover, it can lead to serious complications if left untreated, including heart failure or stroke. In the next few minutes, we'll delve into 15 key pieces of information about heart valve disease that you need to know. First off, what is the function of our heart valves? Well, the heart, a key player in our body's circulatory system, boasts 4 valves. These are the mitral, tricuspid, pulmonary, and aortic valves. Each valve has a one-way street kind of role. They open to let blood flow through and then shut to keep it from flowing backward. Imagine them as gatekeepers, directing traffic in a bustling city. As the heart beats, these valves open and close, ensuring that blood travels in the right direction. They are vital in maintaining the rhythm and flow of our life-giving blood. But what about when things go wrong? When these valves don't open or close correctly due to damage or disease, the heart's efficiency as a pump is compromised. The blood flow can be slowed down, diverted, or even blocked entirely. When these valves fail to perform their function, that's when we encounter heart valve disease. So, what causes heart valve disease? Well, heart valve disease can be attributed to several factors. One of the most common causes is simply aging. As we grow older, the heart's valves can naturally become stiffer and less flexible, leading to a condition known as degenerative valve disease. Another common cause can be infections. Sometimes bacteria in the bloodstream can lead to a condition called infective endocarditis, which can damage the heart valves. Rheumatic fever, a complication of untreated strep throat, is another infection that can lead to heart valve damage. Congenital heart defects, or heart problems that you're born with, can also cause heart valve disease. Some people may be born with valves that are not formed correctly, or with valves that have only 2 leaflets instead of the usual 3. Remember, understanding these common causes is crucial. It can lead us towards early detection and prevention, and that's a step in the right direction. Identifying these causes can help in early detection and prevention. Now, how do you know if you have heart valve disease? You may be wondering. Well, there are some common symptoms to be aware of. First off, you might feel fatigued or unusually tired. This isn't the typical end-of-a-long-day tiredness, but rather a consistent feeling of exhaustion that doesn't go away with rest. Secondly, you may experience shortness of breath. This could occur during daily activities or even when you're at rest. It's a feeling like you can't catch your breath, a sensation that can be quite alarming. Finally, chest pain is another symptom to take note of. This isn't the sharp, sudden pain often associated with heart attacks. Instead, it's more of a pressure or aching sensation in your chest, particularly during physical activity or under stress. Recognizing these symptoms early on can make a significant difference in managing the disease. So don't dismiss these signs. If you're experiencing any of them, it's important to seek medical attention. Did you know there are different types of heart valve disease? Yes, indeed, and each variety presents unique challenges. Let's delve into that a bit. First up is aortic stenosis. This condition occurs when the heart's aortic valve narrows, preventing the valve from opening fully, which increases the heart's workload and can lead to heart failure if not treated. Next, we have mitral valve prolapse. This is when the valve between your heart's left upper and lower chambers doesn't close properly. It's usually harmless, but in some cases it can cause blood to leak backward and lead to heart complications. Finally, we come to tricuspid regurgitation. This is a condition where the tricuspid valve, located between the 2 right heart chambers, doesn't close tightly. This can cause blood to flow back into the heart's upper right chamber. Each type affects the heart in different ways and requires specific treatment approaches. So, getting a correct diagnosis is crucial to managing these conditions effectively. How is heart valve disease diagnosed? Well, the diagnosis process can involve a variety of tests. One common test is the echocardiogram, which uses sound waves to create detailed images of the heart. This allows doctors to see the heart valves in action and identify any abnormalities. Another test that may be used is cardiac catheterization. This involves inserting a thin, flexible tube into a blood vessel that leads to the heart. It can provide a very detailed look at the heart's valves and chambers. An MRI, or magnetic resonance imaging, is another option. This test uses a magnetic field and radio waves to produce detailed images of the heart and its valves. Each of these tests offers unique insights, and often, a combination of them is used to ensure an accurate diagnosis. These tests help doctors determine the type and severity of the disease. What are the treatment options for heart valve disease? Well, let's dive right in, shall we? First off, it's crucial to understand that the treatment for heart valve disease is not a one-size-fits-all deal. Instead, it's a tailored plan, specifically designed to meet each patient's individual condition and needs. There are, however, a few common paths that doctors often consider. Medication is usually the first line of defense. Medications can't fix a damaged valve, but they can often relieve symptoms and delay the need for more aggressive treatment. Drugs like diuretics, blood thinners, and beta blockers can help manage symptoms and improve heart function. Now, if medication alone isn't enough, surgery might be the next step. This can involve repairing the damaged valve or, in more severe cases, replacing it entirely. Valve repair is usually the preferred option, as it preserves the patient's own valve and can often provide a more lasting solution. It includes procedures like annuloplasty, where a ring is sewn around the base of the valve to tighten it, and valvuloplasty, where a balloon is used to widen a narrow valve. On the other hand, valve replacement involves removing the damaged valve and replacing it with a mechanical or biological one. Mechanical valves are durable and last a lifetime, but require the patient to take blood-thinning medication indefinitely. Biological valves made from animal or human tissue don't require long-term use of these medications, but typically need to be replaced after about 10 to 15 years. Lastly, there are also less invasive procedures available, like transcatheter aortic valve replacement, or TAVR for short. This procedure allows a new valve to be inserted within the old, damaged one without the need for open-heart surgery. Remember, the right treatment option depends on several factors, including the patient's age, overall health, and the type and severity of their valve disease. It's a decision made in partnership with a healthcare provider, considering the potential benefits and risks of each option. The treatment plan is tailored to each patient's specific condition and needs. So, it's essential to have open discussions with your healthcare provider to understand your treatment options better. What lifestyle changes can help manage heart valve disease? You might be surprised to know that the answer lies in some simple yet impactful daily habits. Let's start with a healthy diet. Consuming a balanced diet that's rich in fruits, vegetables, lean proteins, and whole grains can significantly contribute to heart health. It's also crucial to limit your intake of saturated fats, cholesterol, and sodium. Next, let's talk about regular exercise. Engaging in physical activities that you enjoy can strengthen your heart and improve your overall health. Just remember to consult your doctor before starting any new exercise regimen. Another key lifestyle change is quitting smoking. As we all know, smoking is detrimental to your heart health, and giving it up can be a game changer for those with heart valve disease. And lastly, reducing stress is a must. Whether it's through meditation, yoga, or simply taking time for yourself each day, managing stress can help keep your heart healthy. These lifestyle changes can significantly help in managing symptoms and improving quality of life. What happens if heart valve disease is left untreated? This question is more important than you might think. Leaving heart valve disease untreated can lead to a host of serious complications. For starters, the heart might weaken over time, leading to heart failure. This means the heart can't pump blood efficiently to meet the body's needs. You may experience symptoms like fatigue, shortness of breath, and swelling in your legs and abdomen. Another risk is stroke. If the heart isn't pumping properly, blood may pool and form clots. If a clot travels to the brain, it can block blood flow, resulting in a stroke. Lastly, untreated heart valve disease can lead to sudden cardiac death. This is when the heart's electrical system malfunctions, causing the heart to stop beating unexpectedly. So, the risks of untreated heart valve disease are quite severe. It's crucial to seek treatment early to avoid these serious complications. Why are regular checkups important for heart valve disease patients? Now let's talk about this crucial aspect of managing heart disease. Regular checkups hold the key to monitoring your heart valve condition, and here's why. Regular medical checkups are like tracking the progress of a journey. You wouldn't set off on a long trip without regularly checking your map, would you? Similarly, regular checkups are the compass that guides your health journey. They allow your healthcare team to keep an eye on the progression, or hopefully, the regression of your disease. These appointments also provide an opportunity to adjust treatment plans. Just as a tailor would adjust a suit to fit perfectly, your healthcare team adjusts your treatment plan to fit your needs perfectly. This could involve altering medication, suggesting lifestyle changes, or even considering surgical options. So, never underestimate the power of regular medical checkups. They're not just appointments. They're your opportunity to take control, stay informed, and ensure your treatment is as effective as possible. Routine checkups are key in managing heart valve disease effectively. How does heart valve disease impact quality of life? It's a question that inevitably comes up, and the answer is multifaceted. Heart valve disease can significantly influence daily activities. Imagine feeling short of breath doing simple tasks like climbing stairs, or feeling fatigued after a short walk around the block. These physical limitations can be frustrating and challenging to cope with. Moreover, heart valve disease doesn't just impact physical capabilities. The emotional toll can also be substantial. Living with a chronic condition often brings feelings of anxiety, depression, and fear. The unpredictability of symptoms can be unsettling, creating a sense of unease about the future. But it's crucial to remember that heart valve disease is not a death sentence. With proper management, patients can lead fulfilling lives despite the disease. This might involve medication, lifestyle changes, or even surgery. The key is to work closely with your healthcare team to find the best way forward for you. With proper management, patients can lead fulfilling lives despite the disease. What role do family and friends play in managing heart valve disease? Now that's a question with a heartwarming answer. When faced with any health challenge, especially something as life-altering as heart valve disease, the support from loved ones can truly make a world of difference. Family and friends can help in practical ways, like reminding patients to take their medication on time or driving them to doctor's appointments. But their role extends far beyond just these logistical tasks. They provide the emotional support that's so crucial in dealing with any illness. Encouragement and understanding from those closest to us can help patients maintain a positive outlook and cope with the uncertainties that come with heart valve disease. Moreover, loved ones can also play a role in lifestyle changes, such as adopting healthier eating habits or engaging in suitable physical activities together. They are the cheerleaders, the sounding boards, the comforters, and the handholders. Support from loved ones can be a powerful tool in managing heart valve disease. What does the future hold for heart valve disease treatment? This is a question that sparks hope, curiosity, and anticipation. As we step into the age of medical marvels, the future of heart valve disease treatment is nothing short of promising. In the realm of ongoing research and advancements, one exciting development is the evolution of minimally invasive procedures. Traditionally, heart valve surgery required opening the chest to access the heart. However, with the advent of technology and precision instruments, we're moving towards procedures that are far less taxing on the patient. These minimally invasive techniques involve smaller incisions or even catheter-based approaches where instruments are threaded through the blood vessels. This not only reduces the physical impact of surgery but also shortens recovery time, making the healing process easier and more comfortable for patients. Then there's the revolution brought about by bioprosthetic valves. These are artificial heart valves made from tissue rather than metal or plastic. The beauty of bioprosthetic valves lies in their compatibility with the human body. They are designed to mimic the function and mechanics of natural heart valves, thereby reducing the risk of complications and improving the quality of life for recipients. Moreover, the field of regenerative medicine is making strides towards the use of a patient's own cells to create personalized heart valves. Imagine a future where the risk of rejection is virtually eliminated because the replacement valve is grown from your own cells. This could be a game changer in the treatment of heart valve disease. Also, let's not forget the power of artificial intelligence and machine learning in predicting and diagnosing heart valve diseases. These technologies are constantly being refined to provide accurate early detection, which is key to successful treatment. In conclusion, the future of heart valve disease treatment is one of constant evolution and innovation. With every scientific breakthrough, we're inching closer to a reality where heart valve disease is no longer a life-threatening condition, but one that can be effectively managed or even cured. With continuous advancements, the future of heart valve disease treatment is promising. Let's wrap up what we've learned about heart valve disease. We've journeyed from understanding the heart's valves to recognizing the causes and symptoms of this disease. We've explored the different types of valve disease and how they can be diagnosed. We've delved into various treatment options and the importance of lifestyle changes. We've stressed the potential risks of untreated heart valve disease and the significance of regular checkups. We've reflected on the impact this condition can have on quality of life and the supportive role of family and friends. Finally, we've peered into the future of heart valve disease treatment, filled with promise and hope. Each of these 15 points serves as a beacon, guiding us in our understanding and management of heart valve disease. They underscore the importance of being proactive and well-informed. Remember, knowledge is power. Understanding heart valve disease can help in its management and improve quality of life.